Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Team Association. This is the time of year in our practices that a lot of us do our annual employee evaluation, and a lot of times we're looking at this to maybe be looking for a pay raise or bonuses or something like that, and I want to urge you to maybe not do this at the same time. That if you're going to look at an annual salary review, do that separately. But have this just to be a performance appraisal and something that you can have a conversation with your employee regarding what you want to do for the next year. So to help this, I have a employee appraisal form that I would use, and there's actually two forms. One that the doctor fills out and one that the employee fills out. And the questions are very much the same as to what are some of your best skills and what do you think you do really, really well in the office. And another one is what do you think you need improvement on. And then it will be what is the priority of these, so we know what we're going to work on first and second and going from there. And then with this same conversation, you could talk about their professional goals, what they would like to maybe learn, and what are some of the personal goals, things that they would like to do on their personal side. Because it's all about encouraging them to become a better person, and with that, then more well-rounded, and that can help your office. So you would give the form out to your employee, say the same week that you're going to do it, no more than a week ahead, and ask them to complete these questions and that you're going to sit down and go over them. And then once you do have that meeting that's scheduled, you would then exchange papers, and they would be able to read what you as the doctor wrote about their skills and what they're doing really well with and what they're needing some help with. And those are the only two questions you fill out ahead of time. And then you would look and see what the employee wrote as to what their best skills are, what they think they bring to the office, and what they think they need some improvements on. So this is a great way to just kind of discuss how they're doing. And you will be surprised at how many of these things are similar. What you think they do great with, they do too. And what you think they need improvement on, they do too. It's not always that much, but there's occasionally some overlap there, which is a very great place to start the conversation as to that you agree with them. So you can change the papers back if that makes you feel better, so that you've got your one that you say what you think about the employee and they have the one that they think. You definitely want to make a copy of each one at the end of the conversation, at the end of the meeting, and so that they know what their future plans are. So you start that conversation with what are they doing well, and see where you guys overlap and where you are similar with what you say about it, and you're giving the meeting off on a very positive first note because you're talking about what they're doing great with. And then you move on from that into what they need some help with, what they need to improve on. And this leads naturally into what personal growth or professional growth do they want to achieve, and how can you help support that? You can help them figure out what their professional growth might be and what their personal goals are going to be by asking the question. It's like, where do you want to be, or where do you see yourself in the next few years? Or what specific goals would you like to achieve in the next few years? And see how you as the doctor can help support them in that growth. So let's look at the professional side first. So say they are a front desk person, and you see on the evaluation that what they need help with is a little bit more on the customer service side, maybe with communication skills. So you could, the doctor, send them to a customer service course. Send them to a course that offers more communication skills. That's one way you can improve them professionally and personally and still get a value back for you at the office. Another one might be if it's another front desk or admin team person and they want to learn a little bit more about the back, the clinical side, maybe you could do some cross-training and have them become a hygiene assistant or even just a sterilization tech that they can step in and help when things get really slammed back there. So you would have a little cross-training going on. This is also a great way to cross-train for some of your clinical people to learn a little bit more about the front desk and the scheduling or billing codes, so they can answer more of the questions that the parents might have and help take some of the weight off from your front desk. An assistant who might be wanting to become maybe a treatment coordinator, you could send them to a course on billing codes and procedures and communication skills. And you can use the modules that we have for our PDTA members that are on communication skills. They're also on how to present treatment plans and even some of the science behind them. So if they have a parent asking about why do we need that fluoride again, we just had it 6 months ago, they've got the science behind our recommendations. Same thing with maybe knowing the different kinds of pulp therapies and why we recommend one over another. So these are just some of the ways that you can be looking at improving your inter-office skills and base it off of what that employee wants to do. But if they know that you'll support them in additional learning, they might be more willing to learn some additional training that can help you make your office run more smoothly and be more productive. Another thing to think about is if you have a multicultural office, maybe you would like some more of your team to learn an additional language. And if that happens to be Spanish, then maybe you could ask the team members who want to attend a basic Spanish class, and you could even have it maybe in your office by hiring a tutor for that. And you can at least teach them the things they need to know for every day in your practice working with the patients. So these are just some ideas you can use to help you with the growth and development of your team, which will aid you in the retention of your team. And now what some of their personal goals are, it might be something that you could help them also with. Maybe it's on the finance end or learning to budget. Maybe it's a special hobby that they use that will help them manage their stress at home. So look for ways that you can help them personally also that will benefit you in the office. Maybe it's going to be a gym membership. Who knows? But whatever it is, you want to see if there's a way you as the doctor and as the practice can support them in that, and they will know then that you are looking out for their best interest as a person and also how they can grow in the practice and become more valuable to you in the practice. If you would like a copy of what my employee appraisal is, just reach out to us by phone call or by email, or just reply to this email, and in the subject line just put employee appraisal, and we will send you those forms, and that will help you get into more of a conversation with your employee at the year end when you're evaluating the whole year, and come up with an actual plan for them to improve on the things you think they need to improve on. Another just little caveat is make sure you can try to look at this as the whole year that you're evaluating. So many of us tend to look at just the last couple of weeks or even the last month. So see if you can find some things that they did well earlier in the year and talk about those also. This has been your Practice Pearl from the PDTA, and I'll see you on the next one.